Our first module is sit to stand. We'll show you how to take patients who may have just had surgery, put them in an unloaded position to take weight off their injured knee, and take them again through more difficult exercises. We'll even show you how to do a lunge with the patient. And at the end, we'll show you some balance and proprioception exercises. The first exercise we're going to do today is the level 1 squat. This exercise is for someone who just had lower extremity surgery, hip, knee, or possibly they have difficulty going from sitting to standing. So we are going to bring a chair in here, close to the band. Patient, come on in for me. And you're going to step over the band. Okay, so on this exercise, we want maximal support. So we're going to start with a level 1 band here. And we're going to pull the band up to where the hamstrings meet the glutes. Right there. Good. Okay, and then we're going to move the chair in, and then you can come back till you feel the chair on the back of your calves. Go ahead and grab up on the straps. Okay, so what we're looking for here is if the band is the correct resistance. Go ahead and have a seat for me, and she should be able to easily go down. The band will stretch, and she has maximal assistance at this point. Now come on up. Good. And you need to be asking the patient, do you have any pain? Because there shouldn't be any pain in any of her joints as she does this. 3 more for me. Good. And I'm giving her some tactile cueing. Just make sure she extends her hips. 1 more. And all the way up. Good. And that's a level 1 squat with a chair. The next level 1 squat, we will do it without the chair. So this makes the exercise a little more difficult and requires more confidence from the patient. So we're going to go ahead and raise the band to the gluteal fold. We're going to find that same spot. We're going to make sure it's nice and snug. I'm going to switch sides here and go ahead and take a step back. And I'm going to come in and block her knee to make sure her knees don't go past her toes. We're going to hold with her hands on the band like that, and go ahead and do a squat for me. Okay, and that's as far as you can go. So what has happened here? You can come back up for me. The band is too tight. So a way to adjust this is to take the band release lever, and we're going to take it down 2 inches on both sides, and lever up. Okay, now it's going to give her less help, which will equal more stretch. Go ahead and pretend there's a stool beneath you, and down, and then up. Tactile cue, extend those hips, glutes tight, blocking her knee. Good. 3 more for me. And all the way up. Good. And that's a level 1 without the chair. Okay, our next exercise is going to be the level 2 squat. This is a more advanced squat for, again, people who have just had lower extremity surgery or need strengthening of their quads, glutes, hamstrings. Emily, step through for me, please. Good, and now we're going to walk the patient back. Walk back for me. Keep coming. All the way back, and then the band's going to go underneath her arms. Okay. So we want the patient at between a 20 and 30 degree angle, so you're going to move your feet forward for me. Good, and lean back in the band. And now I'm going to go down again here to block her knee to make sure her knee doesn't go past her toes. And go ahead and pretend you have a stool underneath you and have a seat. Good, and up. And I'm making sure we don't see any adduction, internal rotation of her knee and femur. Good, 3 more. So this has less assistance because of the band placement. Good. All right, and that's a level 2 squat. Okay, our next demonstration will be our level 3 squat. Emily's been in physical therapy for a few weeks now. She's graduated from her level 1 squat to her level 2 squat. Now let's attempt a level 3 squat, which will give her the least help. So come on in for me. And you're going to go ahead and walk back. And again, the band placement is the same as level 2, but now we're going to take her arms out to her sides. And now I'm just going to give her more of a standby assist because I shouldn't have to be watching her knee as much. Good, Emily. Let's see that perfect squat for me, please. Good, and up. Again, great exercise for our patients who are ready to graduate outpatient physical therapy. Make sure they can do that. We're watching the knees again, and everything looks good. Now, you might run into this at times. The patient might get too far forward. Go ahead and show me what could go wrong, Emily. So we need to watch this. So look at her trunk. We don't want that. We want her trunk perpendicular to the floor. So come on up. So trunk forward, that's bad. To fix that, we're going to do feet forward. So inch your feet closer to the, there you go. Now let's see if we can do that perfect squat for me. Much better. Come up, and then one more. And up. Good. Okay, so that's a level 3 squat with a correction at the end because her trunk went forward, so we need to move her feet forward to get in the perfect position. The next exercise we're going to show you is a level 1 lunge. The level 1 lunge is great for post-surgical patients of the hip and knee, also people suffering from patellofemoral pain syndrome. Emily, come on into the band for me, please. So this is a reverse lunge, so it's going to focus more on hamstrings and glutes than a forward lunge would. So I'm going to come in here, and we're going to take the ring straps, and we're going to pull the ring straps down. And again, the patient's going to find where the hamstrings meet the gluteal fold, and we're going to get it nice and snug there. Okay, and now take a step back for me. And we need the therapist to make sure to come in and block her shoe so we don't have her knee go past her toe. With your right leg, you're going to reach back for me. Good. Okay, go ahead and do the lunge and come on down. So I'm keeping an eye on her femur and her knee to make sure there's no internal rotation or adduction of the knee, giving you her little tactile cueing. Great, one more for me. Okay, do you have any pain? It's okay? All right, that's a level 1 lunge. The next exercise we're going to show you is a level 2 lunge. Level 2 lunge is also great for post-surgical patients, patients with hip instability, patellofemoral pain syndrome patients, because we're using the band to unweight the joint. Okay, so Emily, come on inside the band for me, please. And we're going to walk back. Keep coming. And the band's going to go underneath your arms there. Okay, go ahead and lean back and step forward for me. Good. Now at this point, it's great to cue the patient to have their left foot in between the anchor points. Good. All right, now I'm also going to block out the knee just in case we have the knee going past the toes. With your right leg, you're going to reach back and your hands on top of the band. And go ahead and squat down and then bring that right leg back up to the left. Good. Great. And I'm just giving some tactile cue for her hips so she goes into extension at the top and there's no flexion at all. Good. Perfect. On the knee, I'm watching for any adduction, internal rotation of the femur. 2 more for me. Good. And 1 more. And great. Now, this is a good point to bring up that we are using a 2 band, which is going to unweight her knee more than a level 1 band. And it's also keeping her trunk nice and perpendicular as she lunges back. And that's a level 2 lunge. Okay, the next exercise we're going to look at is a level 3 lunge. Once again, it's a great exercise for our post-surgical patients, patients with hip instability. But one thing, this is a more advanced lunge, so make sure this is at the end of their treatment when they're ready for graduation. Okay, Emily, come on in for me, please, and go ahead and walk back. And we're using a level 2 band here to really unweight her joint that's been injured. Come on back for me. Okay, so put some charge into the band, step forward. Is our left foot between the 2 anchor points? Good. Now, as a therapist, I want to be down looking at her knee, giving some tactile cueing on her hips as well. And this time, Emily, you're going to reach back with your right leg, touch the mat, and then return it to the starting position. Okay, go ahead. Reach back and squat, and then return it to the starting position for me. Good. 2 more of those. So everything's looking pretty good. Watching her knee, it looks in line. Now we're going to make it a little more difficult. I want you just to reach back your leg and not touch the mat. So just hover it and then come back to starting position. How does that feel?
I can do it.
Okay, 2 more. Doing really good here. Okay, now the third and most difficult progression. You're going to reach your leg back and then Come all the way through up into hip flexion, good, and then back and touch, good, that's great. So 2 more for me. And we want to make sure we're not adducting the knee at all, and that looks great. Good job. And that's a level 3 lunge. All right, now we're going to move on to some balance and proprioception exercises. The next one is called pull, stand, stabilize, and there's several progressions in that, but we're going to start with the easiest one first. And this is for patients, could be post-surgical, that are suffering some proprioception problems, older patients that need balance training. It's a very effective exercise.